Have you ever stopped and wondered what really happens to your prostate if you masturbate every single day? It's one of the most common questions men think about privately, yet very few feel comfortable asking. Many men spend years worrying about whether daily ejaculation could harm their prostate, increase their cancer risk, or slowly damage their health without them even realizing it. The truth is, there is a lot of confusion surrounding this topic, and much of it comes from outdated beliefs and misinformation. Today, we're going to clear up those myths using real medical science so you can understand exactly what happens inside your body and make informed decisions about your health with confidence. For many men, the prostate remains a mystery for most of their lives. It's a small gland that rarely gets any attention until something starts to go wrong. By the time urinary problems, discomfort, or other symptoms appear, many people wish they had learned about their prostate much sooner. Unfortunately, embarrassment often prevents men from asking important questions or seeking reliable information. Ignoring your prostate, however, does not protect it. In fact, avoiding these conversations can delay early detection of problems and make future health issues much more difficult to manage. Understanding how this gland works is one of the most valuable steps you can take toward protecting both your health and your quality of life. In today's discussion, we're going to explore what medical research actually tells us about ejaculation frequency and prostate health. I'll explain the 3 biggest changes that naturally happen to the prostate after the age of 40, discuss what daily masturbation really does inside your body, and then share a simple 4-pillar plan that can help you support your prostate for many years to come. Make sure you stay with me until the end, because one of the most effective ways to support your prostate involves a food that is probably already sitting in your kitchen, and many people have no idea how beneficial it can be. Before we continue, I'd like to ask you for one quick favor. If you find these educational videos helpful, please take a second to press the like button and subscribe if you haven't already. It helps this channel reach more men who may be looking for trustworthy medical guidance. I also enjoy reading your comments, so let me know where you're watching from. It's always encouraging to see men from different countries coming together to learn, support one another, and take better care of their health. Now let's answer the question that brings so many people here. Is frequent masturbation actually dangerous for the prostate? Over the years, you've probably heard countless warnings. Maybe someone told you that ejaculating every day weakens the prostate. Perhaps you've read online that it causes inflammation or even raises the risk of prostate cancer. These claims are repeated so often that many men begin to believe them without ever seeing the evidence. Considering that prostate cancer is one of the most common cancers affecting men around the world, it's understandable why these ideas create fear and anxiety. But this is exactly where scientific research tells a very different story. One of the largest and most respected studies, published in the journal European Urology, followed thousands of men over nearly 2 decades. The researchers examined how often these men ejaculated and compared that information with their long-term prostate health. The results surprised many experts. Men who ejaculated more frequently, approximately 21 times or more each month, showed a significantly lower risk of developing prostate cancer compared with men who ejaculated only 4 to 7 times per month. Something that many people had been warned to avoid for years was actually associated with better prostate health rather than worse outcomes. If you're joining me for the first time, let me introduce myself. I'm Dr. Rose, a board-certified urologist, and for the past several years, I've dedicated my career to helping men protect their prostate, maintain healthy urinary function, preserve their vitality, and continue enjoying an active, confident life well into their 60s, 70s, and beyond. Throughout my years of practice, I've met countless men who spent far too long worrying because of myths and misunderstandings about the prostate. Many suffered in silence simply because they believed there was nothing they could do. The good news is, that isn't true. Once you understand how your prostate works, you'll realize that your daily choices have a much greater impact on your long-term health than you may have imagined. Now that we've separated myth from fact, it's time to understand what is actually happening inside your body. Once you learn the biology behind the prostate, Many of these questions become much easier to understand. As men grow older, the prostate naturally changes, and these changes affect everything from urination to hormone balance and overall prostate function. In the next section, I'll explain the first major change that occurs after the age of 40 and show you exactly where regular ejaculation fits into the picture from a medical point of view. The first major change is something almost every man experiences to some degree as he gets older, and that is gradual enlargement of the prostate, along with increased fluid retention. This condition is known medically as benign prostatic hyperplasia, or BPH. Although the name may sound intimidating, it is important to understand that BPH is not prostate cancer. It is a natural part of aging for many men. Even so, it can have a significant impact on daily life. In fact, this enlargement is one of the leading reasons men begin experiencing urinary symptoms after the age of 40. If you've ever noticed that your urine stream isn't as strong as it used to be, or that you have to strain to get started, or perhaps you feel like your bladder never completely empties, these are often early signs that your prostate is becoming larger. To understand why this happens, picture the prostate as a small gland wrapped around the urethra, the narrow tube that carries urine from the bladder out of the body. When you're younger, the prostate usually remains small enough that urine flows freely without much resistance. But as the years pass, hormonal changes encourage the gland to slowly increase in size. Since it surrounds the urethra, even a modest amount of enlargement can place extra pressure on that tube. As a result, urine has a harder time passing through. This is why many men begin experiencing a weaker flow, interrupted urination, frequent trips to the bathroom, and the frustrating sensation that they still need to urinate, even after they've just finished. Now here's where regular ejaculation enters the conversation. Every time ejaculation occurs, fluid stored within the prostate is released. You can think of it as giving the gland an opportunity to empty itself instead of allowing older fluid to remain inside for long periods. While ejaculation is certainly not a cure for an enlarged prostate, maintaining regular ejaculation may help reduce fluid stagnation and support the prostate's normal function. By clearing out accumulated secretions, it may also help reduce some of the congestion that contributes to discomfort and irritation. In other words, you're allowing the prostate to perform one of its natural jobs instead of leaving it inactive for extended periods. This doesn't simply matter on a biological level, it also affects how you feel every single day. Men who experience ongoing urinary symptoms often describe feeling exhausted because they wake up multiple times each night just to use the bathroom. Interrupted sleep gradually leads to lower energy, reduced concentration, irritability, and even decreased motivation during the day. Many also become anxious whenever they leave home because they're constantly thinking about where the nearest restroom might be. Anything that helps support healthier prostate function can contribute to greater comfort, better sleep, and a stronger sense of confidence in everyday life. The second major change involves your hormones, and this is another completely natural process that occurs with aging. Most people know that testosterone gradually declines over time, but fewer people understand what happens next. As testosterone levels slowly decrease, your body begins converting a greater portion of that testosterone into another hormone called dihydrotestosterone, or DHT. Although DHT plays an important role in the male body, excessive amounts can create problems for the prostate. In fact, researchers have long recognized DHT as one of the primary hormones that stimulates continued prostate growth. You can think of DHT almost like fertilizer being added to a plant. When more of this hormone is present, the prostate receives stronger signals to continue growing. Over many years, this gradual stimulation contributes to enlargement and increases the likelihood of urinary symptoms becoming more noticeable. This is one of the reasons some prescription medications for enlarged prostates work, by reducing the production or activity of DHT inside the body. The goal isn't to eliminate the hormone completely, but to keep it at healthier levels so the prostate isn't constantly being encouraged to grow larger. So where does frequent ejaculation fit into this hormonal picture? While ejaculation doesn't dramatically change your hormone levels overnight, research suggests that regular prostate activity may support healthier cellular turnover and help reduce the buildup of stagnant secretions within the gland. Instead of allowing fluids to remain inside for extended periods, regular emptying encourages the prostate to continue functioning as it was designed. This ongoing activity may help create a healthier environment within the gland while supporting its normal biological processes. The benefits extend beyond physical changes alone. Hormonal balance influences far more than prostate health. It also affects your energy, emotional well-being, mental clarity, sexual confidence, and overall quality of life. Many men notice that when they take better care of their bodies through healthy habits, they feel more energetic, more focused, and more confident. Rather than constantly worrying that something is wrong, they gain reassurance from knowing they're actively supporting their health with evidence-based choices. That peace of mind is incredibly valuable because reducing unnecessary stress is itself an important part of maintaining long-term wellness. Understanding these first two age-related changes gives you a much clearer picture of why prostate health deserves attention long before serious symptoms develop. Aging cannot be stopped, but the way you respond to these natural changes can make a remarkable difference in how you feel for years to come. And there's still one more important biological change we need to discuss, one that helps explain why prostate cancer risk naturally increases with age, and how regular ejaculation may play a protective role in maintaining healthy prostate cells. That is exactly what we'll explore next. The third major change that takes place as men grow older involves the health of the prostate at the cellular level. Every single day, millions of cells throughout your body naturally die and are replaced with new ones, and your prostate is no exception. This constant process of renewal is essential for keeping the gland healthy and functioning properly. However, every time a cell divides to create a new one, there is a small chance that a mistake can occur in its genetic material. Most of these tiny errors are corrected automatically by your body's natural repair systems, and many damaged cells are eliminated before they can cause any harm. But as the years pass, the number of cell divisions continues to increase, and so does the possibility that some abnormal cells may survive. This gradual accumulation of cellular changes is one of the reasons the risk of prostate cancer naturally becomes higher with age. Fortunately, your body has several ways of maintaining a healthier environment inside the prostate, and regular ejaculation appears to be one of the factors that may contribute to this process. When ejaculation occurs, the prostate releases stored fluid along with waste products that have collected over time. Researchers believe that this regular clearing process may help reduce the buildup of older secretions, inflammatory substances, and damaged cellular material that could otherwise remain inside the gland. While ejaculation is certainly not a guarantee against prostate cancer, it may support the prostate's natural maintenance process by encouraging continuous renewal rather than allowing unnecessary stagnation. A simple way to understand this is by thinking about a coffee maker that is used every day. If you continue making coffee without cleaning the machine, old residue gradually builds up inside. At first, everything seems perfectly normal, but over time, that leftover material begins to affect the machine's performance, and eventually, mold or bacteria may start developing in places you cannot easily see. Regular cleaning prevents those problems before they begin. Your prostate works in a somewhat similar way. By regularly emptying stored fluid, you're helping the gland perform routine maintenance instead of allowing unwanted material to remain there for long periods. It's a simple habit that supports the body's natural housekeeping process. Now, it's important to keep this information in perspective. Daily ejaculation should never be viewed as a miracle treatment or a replacement for proper medical care. Prostate health depends on many different factors working together: genetics, age, hormone levels, diet, physical activity, body weight, sleep quality, smoking, alcohol consumption, and regular medical screening all play significant roles. No single habit can eliminate every risk. Instead, lasting prostate health comes from combining several healthy choices consistently over many years. That's why I encourage my patients to think about prevention as a complete lifestyle rather than searching for one perfect solution. With that understanding, let's move into the practical steps you can begin applying today. I like to call this the 4-pillar action plan because each pillar supports the others. Remove one, and the overall foundation becomes weaker. Strengthen all 4 together, and you give your prostate the best possible chance of remaining healthy as you grow older. The first pillar is regular medical checkups. In my opinion, this is absolutely non-negotiable. Once you reach your 40s, or even earlier if your father, brother, or another close relative has had prostate cancer, you should begin having routine prostate evaluations every year. These appointments allow us to identify changes long before symptoms become severe. Early detection remains one of the most powerful tools we have in modern medicine, and it has saved countless lives. A routine prostate evaluation usually includes a PSA blood test, which measures the level of prostate-specific antigen in your bloodstream. While a PSA test alone cannot diagnose prostate cancer, it provides valuable information that helps your doctor determine whether further evaluation is necessary. Depending on your age, symptoms, and family history, your physician may also recommend a digital rectal examination. I know many men feel nervous whenever they hear those words. Some even avoid seeing a doctor simply because they're worried about that exam. Let me reassure you, the examination is very brief, usually lasting only a few seconds, and although it may feel slightly uncomfortable, it should not be painful. More importantly, that short examination can provide valuable information about the size, texture, and overall condition of your prostate. Detecting an abnormality early often means treatment can begin sooner, leading to better outcomes and far more options if intervention ever becomes necessary. A few moments of temporary discomfort are a very small price to pay when compared with the benefits of protecting your health for many years to come. Remember, the goal isn't to wait until something feels wrong. The healthiest patients I see are often the ones who come in before problems develop. They understand that prevention is always easier than treatment. By staying proactive, asking questions, and keeping up with regular screenings, you're giving yourself the greatest opportunity to maintain both your prostate health and your overall quality of life. In the next part, we'll continue with the remaining pillars of the action plan, including the foods, exercises, hydration habits, and daily lifestyle choices that can work together to support a healthier prostate for decades to come. The second pillar of long-term prostate health is following an anti-inflammatory diet. Many people underestimate how much the food they eat influences the health of their prostate. In reality, chronic inflammation can gradually affect the entire body, including this small but very important gland. When inflammation remains active for long periods, it may contribute to discomfort, urinary symptoms, and other prostate-related concerns. The encouraging news is that your daily food choices can either increase inflammation or help reduce it. Every meal is an opportunity to support your health or place additional stress on your body. One of the first changes I recommend is reducing foods that are highly processed. Try to limit processed meats, such as sausages, bacon, and deli meats, whenever possible. These foods often contain preservatives, unhealthy fats, and high levels of sodium that do little to support long-term health. Fried foods should also be kept to a minimum because they tend to promote inflammation when eaten regularly. The same applies to excessive amounts of added sugar found in soft drinks, desserts, candies, and many packaged snacks. While enjoying these foods occasionally is unlikely to cause major harm, making them a daily habit can gradually work against your prostate and your overall well-being. Instead, fill your plate with foods that naturally help your body fight inflammation. Fresh vegetables should become a regular part of your meals because they provide vitamins, minerals, fiber, and protective plant compounds that support healthy cells. Fruits offer valuable antioxidants that help defend your body against oxidative stress. Fatty fish, such as salmon and sardines, supply omega-3 fatty acids, which are well known for their anti-inflammatory properties. Nuts provide healthy fats along with important nutrients, while extra virgin olive oil serves as an excellent replacement for less healthy cooking fats. These simple dietary changes don't just benefit your prostate, they also support your heart, brain, blood vessels, and overall longevity. Now let me share the food I mentioned earlier, the one many people already have sitting in their kitchen without realizing how beneficial it may be. I'm talking about tomatoes. Tomatoes are naturally rich in lycopene, a powerful antioxidant that has been studied extensively for its potential role in supporting prostate health. Lycopene helps protect cells from oxidative damage, and several studies have suggested that men who regularly consume lycopene-rich foods may experience better long-term prostate health. One interesting fact many people don't know is that cooked tomatoes often provide even more available lycopene than raw ones. Foods such as tomato sauce, tomato paste, or cooked tomato soup allow your body to absorb this nutrient more efficiently, especially when combined with a small amount of healthy fat like olive oil. The third pillar is regular physical activity. You don't need an expensive gym membership or an intense training program to experience meaningful benefits. Consistency is much more important than perfection. Something as simple as a brisk 30-minute walk on most days of the week can improve blood circulation, support hormone balance, help maintain a healthy weight, and reduce inflammation throughout the body. These benefits extend directly to your prostate as well. Regular movement also lowers the risk of many chronic diseases, improves cardiovascular health, boosts mood, and increases energy levels, making it one of the most valuable investments you can make in your future health. Alongside walking, I encourage men to include some form of strength training 2 or 3 times each week. Building and maintaining muscle becomes increasingly important as we age because muscle tissue supports metabolism, helps regulate hormones, improves balance, and reduces the risk of falls later in life. You don't have to lift extremely heavy weights. Bodyweight exercises, resistance bands, or light dumbbells performed consistently can produce impressive long-term results. The goal isn't bodybuilding. The goal is preserving strength, independence, and overall vitality well into your later years. There's another exercise many men overlook, simply because they believe it's designed only for women. I'm referring to Kegel exercises. The truth is that men benefit from them as well. Kegel exercises strengthen the pelvic floor muscles, which play a key role in supporting the bladder and controlling urination. A stronger pelvic floor can improve urinary control, reduce leakage, and support better bladder function, particularly for men experiencing mild urinary symptoms or those recovering from certain prostate procedures. These exercises are simple, require no equipment, and can be performed almost anywhere once you learn the proper technique. The fourth and final pillar is proper hydration. It may sound surprisingly basic, but drinking enough water remains one of the easiest and most effective habits for supporting both your urinary system and your prostate. Adequate hydration helps dilute your urine, reduces irritation within the urinary tract, and encourages regular flushing of the bladder. When the body becomes dehydrated, urine becomes more concentrated, which can sometimes increase discomfort and contribute to urinary irritation. For most healthy adults, aiming for approximately 2 to 3 liters of water each day is a practical goal, although individual needs may vary depending on activity level, climate, and any existing medical conditions. Staying consistently hydrated allows your urinary system to function more efficiently and supports your body's natural cleansing processes. When you combine these 4 pillars, regular medical checkups, an anti-inflammatory diet, consistent physical activity, and proper hydration, you create a strong foundation for lifelong prostate health. None of these habits are complicated on their own, but together, they work as a powerful team. Small choices repeated every day often produce far greater results than dramatic changes that last only a few weeks. The important thing is to start where you are, remain consistent, and remember that every healthy decision you make today is an investment in your comfort, confidence, and quality of life for many years ahead. Now, I know that some of you listening may be thinking, "Doctor, my body doesn't respond the way it did 20 or 30 years ago. If that thought has crossed your mind, I want you to know that you're not alone. Nearly every man experiences changes as he grows older. Your energy may feel different. Your recovery may take a little longer. Your urinary habits may change. Your sexual function may not be exactly what it once was. None of these things automatically mean that something is seriously wrong. In most cases, they simply reflect the normal biology of aging. Growing older is not a personal failure, and it certainly isn't something to be ashamed of. What truly matters is how you respond to those changes. The men who continue to enjoy excellent health into their 60s, 70s, and beyond are usually not the ones blessed with perfect genetics. They are the men who adapt, stay informed, and make consistent healthy decisions year after year. This brings us back to the question we started with. Is daily masturbation harmful to your prostate? Based on the scientific evidence we have today, the answer for most healthy men is no. When practiced gently, comfortably, and without becoming excessive or interfering with daily life, regular ejaculation appears to be a normal and healthy biological function. Rather than damaging the prostate, it may actually support its natural maintenance by helping clear stored secretions, encouraging healthy cellular turnover, and reducing the stagnation that can develop over time. It is important to remember, however, that balance is always the key. If masturbation becomes painful, compulsive, causes injury, or begins affecting your relationships, work, or emotional well-being, then it deserves attention and a conversation with a qualified healthcare professional. Healthy habits should improve your life, never take control of it. At the same time, ejaculation should never be viewed as the only answer. Prostate health is built through the combination of many positive lifestyle choices working together. Nutritious food provides your body with the building blocks it needs to repair and protect healthy tissue. Regular physical activity improves circulation, supports hormone balance, and reduces inflammation throughout the body. Proper hydration keeps your urinary system functioning efficiently, while routine medical checkups allow potential problems to be detected before they become serious. Each of these habits strengthens the others. When combined with regular ejaculation, they create a comprehensive strategy that supports your prostate from multiple angles instead of relying on a single solution. One of the biggest mistakes I see in clinical practice is that many men wait until symptoms become impossible to ignore before seeking help. They assume that frequent nighttime urination, a weak urine stream, pelvic discomfort, or changes in sexual function are simply unavoidable parts of getting older. While aging certainly plays a role, many of these symptoms can often be managed successfully when they are addressed early. The sooner concerns are evaluated, the more treatment options are usually available. Waiting out of embarrassment or fear only gives potential problems more time to progress. There is absolutely no shame in asking questions about your health. In fact, doing so is one of the strongest decisions you can make for yourself and your family. I also want to remind you that your prostate is only one part of your overall health. Taking care of it often means taking better care of your entire body. A healthy diet supports your heart as well as your prostate. Exercise strengthens your muscles, improves your metabolism, and benefits your mental health. Drinking enough water helps your kidneys, bladder, and urinary tract function properly. Regular sleep allows your body to recover, while managing stress helps regulate hormones and supports your immune system. These daily habits work together to improve not only how long you live, but also how well you live. The goal isn't simply adding years to your life. The goal is maintaining the freedom, confidence, and independence to enjoy those years. So let's summarize everything we've discussed today. What really happens to the prostate when a man masturbates every day? According to current scientific research, regular ejaculation does not appear to harm a healthy prostate. In fact, studies suggest it may offer protective benefits by helping flush accumulated prostatic fluid, supporting normal cellular renewal, and reducing the buildup of substances that could contribute to long-term problems. While this does not eliminate the risk of prostate disease or replace professional medical care, it can be one valuable part of an overall healthy lifestyle. When you combine this habit with annual prostate screenings, a diet rich in anti-inflammatory foods, regular exercise, pelvic floor training, and proper hydration, you give your body the strongest possible foundation for maintaining prostate health throughout the years. If today's discussion helped answer questions you've been carrying for a long time, I hope you'll continue taking an active role in protecting your health. Knowledge becomes truly valuable only when it's put into practice. Even one small change made today can produce meaningful benefits in the future. Perhaps you'll schedule your first prostate screening. Maybe you'll start walking for 30 minutes each day, add more vegetables to your meals, or include tomatoes in your diet more often. Whatever step you choose, remember that consistency matters far more than perfection. Every positive decision moves you closer to better health. Before you leave, I'd like to ask you for one final favor. If you found this information useful, please support the channel by pressing the like button and subscribing for more evidence-based health education. I also encourage you to leave a comment below and tell me one healthy habit you're committed to starting this week to support your prostate. Your experience may inspire another man to take action as well. We learn from one another, and together we can help break the silence that too often surrounds men's health. Thank you for spending your time with me today. Always remember that your age does not determine your vitality. Your future health is shaped by the choices you make consistently, one day at a time. Small improvements today can become greater comfort, stronger confidence, and a healthier life tomorrow. I'm Dr. Rose, and I look forward to seeing you again in the next video. Until then, stay healthy, stay informed, and continue taking care of yourself.